Hi. As you know, I haven't been able to go to Las Vegas this year, and as a bit of a tech nerd, it kind of cuts me up that I didn't get a chance to see the announcements at CES in 2018 in person. So I've been voraciously reading the pages, and this summary I have to thank Mobile Health News and Fortune for their coverage of the announcements at the CES 2018, amongst other great journalistic articles. So what I wanted to do is give you my top 5 trends that I can see coming through the announcements at CES. It's always great to have a conference like CES kicking off the year, and it kind of sets the tone. Usually at this time of the year, I'm planning to head to Los Angeles to attend Abundance 360 with Dr. Peter Diamandis, and that kind of January kickoff where you get a sense of what are the trends to come, what are the things to look for, really critical in order to then disseminate into the Periop Partners database and into our planning for what it is and how we can help our clients be prepared in their businesses. So trend 1 that I can see, let's kick this off, trend 1 that I can see is the smart connected home. And so I talked about this in last week's podcast, and also in a previous podcast, if you look it up from last year, where we looked at the factors affecting aged care. And what we saw there was that the smart connected home, and that's not just Amazon, but Google Home and all the other voice-related services, allows people to start aging within their own home and their own living environments. Why is that important? Well, it allows them to hold on to their assets quite a bit longer. It also means that the usual housing cycle and wealth dissemination into the family doesn't actually necessarily occur at that point in time. But also they get to stay in the family environment with more support than their working adult children can actually typically provide them. They can actually summon services and products into the home whilst remaining relatively independent, and that's the biggest aspect of it. It's great mental health, it's a great and can trend towards a higher quality of life within the home. As I alluded to in last week's cast, the business trend here is essentially to move into the markets at the extreme. So essentially, if you see a bell curve, then you can see that the new technologies that are coming out are really essentially looking at the healthcare spendings at the very young and the very old. And so what this means essentially is that the support for those extremes actually in the end ends up supporting those people in the middle of the curve, because it is those people that are being squeezed by a rapidly aging population and this kind of triangle of inversion that's occurring in the pyramids, in the population pyramids. It also means that those middle of the range consumers, or the middle-aged consumers, of which I'm very aware that I am now one, have the disposable income to actually spend on retail devices, which you definitely saw at CES. And this gets connected to the second trend that we definitely saw coming out of CES, and that was the idea of robots as replacements, not just of the mechanical aspect of labour, but really as companions within the home or within care facilities. So again, bridging over a number of social trends that we can see: falling birth rate, elderly population, but also wage costs as an impact on profits, especially with rising competition, falling profits. The risk there is that you essentially have a higher and higher expectation of the level of service and less ability to actually provide that using human-based services. So as seen in CES 2018, companies like Honda and Horizon creating companion robots who are specifically targeting the aged care market. So I guess one of the challenges about these robots is that they may not yet have crossed the uncanny valley. I think some of them resembled more like an inverted bowling pin, plastered with kind of emoticons, or like an inverted Big Six robot for those guys of you out there that are really big fans of the cartoons. One of them actually reminded me of a hyperactive Google Home. The importance here is that the indication of the robots is that there's this kind of combination of artificial intelligence, the ability for microprocessing, and the importance of, I guess, the ability to communicate facial expressions that are more nuanced, complex emotions like compassion or disappointment and empathy. And those things will actually help that companion robot really start to take off. Trend three is the addition of IoT plus 5G. So this IoT and the 5G equals to anytime, everywhere. So it's not just the ability for sensors to be embedded into everything, and microprocessors being small enough to allow some degree of local processing before it gets sent up to the cloud and then additional processing. There's local intelligence, increases the response time. It means that the devices basically become a lot smarter and they seemingly can kind of think for themselves and respond to much more and many more scenarios within the environment. And where that's really important, though, is that that ability to source even greater nuances of data and data points within it. This, of course, can lead to overwhelm, and definitely you can see that in some parts of the healthcare profession where essentially it extends beyond the existing level of research that we essentially have. I mean, when we went to med school, when I went to med school, we were taught, 6-month ECGs or Holter monitors, but now we're faced with 6-minute ECGs or 6-second ability to read heart function. I mean, essentially the ability to interpret that becomes to a point of time far better to be processed by machine learning or data algorithms. What this also allows is that this combination of processing and transmission speeds and the ability to actually detect a number of nuanced data means that your true vision, or our company's true vision of healthcare anytime, everywhere, is really coming to the fore. And you can see that essentially that healthcare, which is typically a location-specific, local service provider kind of style of service, is really going to burst through those geographic boundaries. And that essentially means that healthcare just opens wide up and you have the healthcare turned, the healthcare service proposition turned on its head. And that's just in time for trend number 4. Trend 4 is the blending of fashion and healthcare. What I like about this one, this is kind of crazy. I don't know if you've seen the L'Oreal UV patch. If you want to see the links, then check out the blog that will have all the show notes inside it and the links to the devices that we're mentioning. Well, the UV patch basically is like painted nail, basically tiny, and it fits on a person's finger and it detects the amount of UV, and then it takes that information amongst other data points and again sends it back up into the cloud, processes and it tells people how much UV they have had, how much sunscreen they need to essentially apply. What I love about this is a really impressive innovation, and what I love about this is that first, this is a battery-free, fashion-conscious wearable. So I'm not sure if you've seen some of the wearables out there that do good. And I'm not talking about a Fitbit or any of the other ones that are essentially a modification of a watch, right? What this is essentially that it's something that the fashion-conscious people would actually consider wearing. The second is that it heralds the entry of fashion and beauty houses into healthcare, which I think should start striking the fear of, into the hearts of many, many sub-industries of healthcare. I mean, fashion and beauty is not only just powered by the billions of dollars that essentially can be seen, on a frequent basis. It's equivalent to multiple Apples basically coming into the space. People who know how to convince people to do certain activities, change their behavior, adopt certain trends. This is essentially that point where society has good health, which is a measure of wealth, and now good preventative health was actually going to be much more affordable and spread out across the masses. So I think good things will actually come out of this if applied well. The final trend, well, this can't be a tech broadcast if we don't mention blockchain. And there were special sessions at CES dedicated to discussing the blockchain. I think that the volume of technology vendors that were on hand to discuss the potential application for blockchain were breathtaking in and of itself. But I particularly found Jackie Finn, who's the digital health head at Cambridge Consultants. The way that she summarised the use cases seems to be the most succinct and most applicable. So she said, if the data is dynamic, if the current solution that they're going to have is fragmented, and if there's suspicion of malicious activity. And now this was definitely brought up if you look up an event that I emceed last year with Peak 15, which is one of the leading healthcare and technology groups down in Melbourne, Australia. And we had a event that was sponsored by the banking group ANZ. And one of the speakers, Sam Lee, runs his own blockchain company, and he had spoken at Davos, yes, at Davos, about blockchain. And really, he presented his own opinions about these applications, and one of them that was discussed at the event was the interest in, I guess, local community insurance networks. And I thought that was absolutely fascinating, your ability to basically create a trusted network where the solution essentially is, the data and solution is essentially dynamic, and that trust is absolutely is essential. So given the volume of data that we're essentially creating and the interest and increase in connectivity and the concerns around the privacy around that data and how it's housed and how it's transmitted, how it's even collected here in the UK, where GDPR is becoming increasingly a timeline that we're all marching towards. Absolutely, there's applications for blockchain to healthcare, and I can't wait to see what 2018 brings out for all of these discussions. So those were the 5 trends of healthcare predicted for this year. That's from the CES announcements. I'm really looking forward to essentially the way forward through this next 12 months. Just recapping, it's the smart connected home, the ability for companion robots, and the service, I guess, of the extremes, the very young and the very old, through this technology. IoT and 5G leading to healthcare anytime and everywhere. The blending of fashion into healthcare. And finally, the use of blockchain into healthcare. Hope you've enjoyed it. If you like it, please subscribe and take a look at our blogs. Thanks.